Good morning, sir. I am Isajan Weska from BSN 1A, and I am here to demonstrate the principles and techniques on properly taking vital signs. Vital sign is also called cardinal sign. From the name itself, it is called vital or important because it provides critical information about the patient's physiologic status. Originally, we have four vital signs. We have the temperature, pulse rate, respiratory rate, and blood pressure. So in addition to this, we have the fifth vital sign, which is pain rating. So let's begin.
Step 1. Gather and prepare needed equipments.
What we need is a stethoscope, sphygmomanometer, thermometer, watch with the second hand, red and blue ball pen, pencil, cotton and alcohol, and a tray.
We must perform hand washing in order to reduce the number of microorganisms in our hands and to reduce the risk of transmitting disease-causing microorganisms to our patients and other healthcare providers.
Next step is to introduce ourselves to the patient, explain the procedures to be done, and establish rapport. It is important to establish rapport in order to gain the trust of the patient and for them to be comfortable when giving the necessary information, just like this. So, good morning, ma'am. I am Nurse Isajan Weska and ako, ma'am, ang nurse na na-assign sa imo subong. So, ma'am, ano yung ngalan?
Si Lorena Estante.
Lorena Estante. So, ma'am, ako haon ta subong imo nga vital signs, imo nga temperature, respiratory rate, pulse rate, and imo nga blood pressure, kag ang imo nga pain assessment. Okay lang sa imo, ma'am?
Okay.
Okay. Before taking vital signs, we must remember that we have to make sure that the patient have rest for 5 to 10 minutes in order not to alter the results of the vital sign taking. For example, if the patients have been outside and the temperature in the outside is hot or either cold, or the patients have traveled for a long time, so we make sure that the patient have rest for some minutes. If the patient have rest, it's the time to take her vital signs in order to ensure that the data is accurate. So the next step is to do the ACS1, which is the pain assessment. It is important to take the pain rating of the patient because if the patient felt pain, it could alter the vital signs taking. Like for example, if the patient felt pain, it could increase its heart rate, blood pressure, or respiratory rate. In taking the pain rating of the patient, we use the numerical pain rating scale, which is from 0 to 10. So just like this. So ma'am, may pain ikaw ma'am nga nabatyagan subong? Kung ma'am, kung i-rate abi ma'am from 0 to 10 and 0 wala pain, then 10 amo na ang pinakasakit. Pila imo i-rate ma'am? 5. Okay. So the patient rating for the pain is 5. So we need to add further questions. So ma'am, pwede mo ma-point out ma'am kung din ang masakit nga particular lawas mo?
Dili banda sa likodan niya.
Okay. Sa upper part ma'am? Okay. Ma'am, ma'am ang dumaalay, do ginatuslok-tuslok or masakit gid ang kasi ka pain?
Maalay nga daw gabingod.
Ang sa sulod gid ma'am ang sakit. Okay. So ma'am, kung ang sakit na nagalatay pa kadto diri sa tubang mo or sa may hawak mo?
Dili lang banda sa likod nila.
Okay. Wala ang ma'am galatay.
Wala.
Okay. So the next step is taking the temperature of the patient. So the normal temperature is between 36 to 37.5 degrees Celsius. But there are factors that could alter the temperature. Like for example, the age, environment, stress, and exercise. And there are various sites where we could get our temperature. Like for example, in our oral, rectal, axillary, and tympanic temperature. But for now, we're gonna use the axillary temperature using our digital thermometer. But before using it, we need to disinfect it to ensure that it is clean. So, in cleaning, we use first the cotton with alcohol. Then we're gonna use the dry cotton. So this digital thermometer, we're gonna place it to the armpit of the patient. But before that, we make sure that the patient's armpit is not moist for us to get an accurate result. Just like this. So ma'am, kuhaon ko ma'am imo subong nga temperature. So pwede na ito ma'am i-fold. Okay. So ma'am, ano na natin. Okay. So we're gonna leave it for some minutes and wait until the thermometer beeps. So, okay na ma'am. So, aton nga temperature is 36.6. Normal man siya ma'am. Okay. So, after using the thermometer, we have to disinfect it also. The next step is we need to get the pulse rate of the patient. So in getting the pulse rate of the patient, we are assessing for the rate. So the normal rate for the adult is 60 to 100 beat per minute. So if it is greater than 100, we call it as tachycardia, and if below 60, we call it as a bradycardia. We're also assessing for its rhythm, if it is irregular or irregular, and also for its strength using a pulse rating.
So the pulse grading scale: 0 pulse is absent, 1 plus pulse is weak, 2 plus it is normal, and 3 plus bounding.
So in pulse rating, we first locate the pulse site on our patient. So in elderly, just like this, we are using the radial pulse. So a radial pulse is aligned with our thumb and here in the wrist. So ma'am, ibutan na di ma'am. Then, we're gonna be using the index finger and the middle finger. And we are not using the thumb because the thumb has a pulse. So this, we locate the radial pulse. We don't have to put too much pressure on the pulse, just light pressure. So if the beating is irregular, we have to count for 30 seconds, then it times to 2. But if the beating is irregular, we have to count it for 1 full minute or 60 seconds. So the next step is taking the respiratory rate of the patient. It is 1 inhalation and 1 exhalation equals to 1 cycle. So there are 2 types of breathing. We have the thoracic breathing, the chest goes up and down, and the diaphragmatic breathing, the diaphragm goes up and down. So in taking the respiratory rate, we are assessing for the rate. So the normal respiratory rate is 12 to 20 breaths per minute. And we are also assessing for its depth, if it is a normal, shallow, or deep breathing. So for taking the respiratory rate of the patient, we don't have to tell the patient that we are taking their respiratory rate because they could alter their breathing. So just like this. So we're going to act like we are still getting the pulse rate of the patient. So we have to move the arm to his chest and put the hand on the back of the patient. Okay, so if respiratory rate is regular, if the rhythm is regular, we're gonna count for 30 seconds, then multiply it in 2. But if it is irregular, then we have to count for 1 full minute or 60 seconds. So after this, we are going to document the data. So the last step is we have to take the blood pressure of our patient. So we are assessing here for the systolic pressure, which is the first loud sound that we could hear, and the diastolic pressure, which is the last sound that we could hear. So the normal blood pressure is less than 120/80 millimeter mercury. So before that, we have to prepare our equipment. So we have to get our stethoscope, and our sphygmomanometer. And we have to ensure that our patient is sitting comfortably and the forearm is on the table, like just like this. Ma'am, relax lang, ma'am. Forearm is on the table. The palm is facing upward, and the forearm is at the level of the heart. So we need to first to assess the brachial pulse of our patient. So right here. Then we have to put the cuff or the sphygmomanometer on our patient. So we have to ensure that the cuff is appropriately sized for our patient, because if it's too large or too small, it could alter the result. So in placing the cuff on our patient, we have to fold the clothes and ensure that the arrow here is pointing on the brachial pulse. So we have to ensure that the cuff is not too loose or too tight to our patient's arm. So here. Then we have to put the gauge, and we have to ensure that the air valve is turned clockwise. And then we have to make sure that the diaphragm is on by tapping it. So in holding the stethoscope, we have to hold it just like this so that we don't mishear our own pulse. So we have to put this on the brachial pulse of our patient.
Pila BP ko dahil.
So ma'am, your BP is 110/80.
Okay. Normal man na siya.
Oo ma'am.
Thank you. Sabi ko kung high blood ko. Normal man gali.
Okay na ma'am. And then after this, we have to document the data.